Another drug that we're just going to briefly talk about is a drug that is given for heparin toxicity. We talked about Coumadin toxicity if you have too much on board, and we know that the antidote for Coumadin is what? Vitamin K. Just remember K, Coumadin. That's the antidote. Well, sometimes people will get heparin toxic also, whether it's because of a med error in a clinical setting or after dialysis or surgery where heparin was used. And if that's the case, they need to give an antidote, and the antidote that they give for heparin is protamine sulfate. You want to remember protamine sulfate. Protamine sulfate is a favorite question on NCLEX and ATI. It was on my own NCLEX. I remember coming to that question, what's the antidote for heparin toxicity? And I was thrilled because I thought, yay, I'm going to get one question right. So just remember, heparin sodium can be reversed with protamine sulfate. Let's talk about protamine sulfate. It is a very strong drug. It's an alkaline protein that neutralizes the effects of heparin. Protamine sulfate is actually an anticoagulant by itself, but its effects cannot be as easily controlled, so they don't give it to somebody as an anticoagulant. But when it runs into heparin in the bloodstream, they kind of clash and they neutralize each other, or the protamine neutralizes the heparin. The results start happening immediately, and protamine can last 2 hours or more in the bloodstream. This is a section from drugs.com that I copied the link here so that you can read a little about protamine sulfate use. It's used for treatment of heparin overdose. So say maybe somebody sets up a bolus of IV heparin and they're supposed to change it to maintenance, and they miss that order, and so large amounts of heparin are going in. I have actually seen that happen. I didn't do it, but I saw it happen, and protamine was indicated. It's more commonly given after a surgical procedure where heparin was used. Now, the thing with protamine is it is only supposed to be given by a physician. It has to be given IV push, and it has to be given very slowly over about 10 minutes. Now, as LPNs and even RNs, we should not be asked to give protamine sulfate. However, you're probably going to be the one that's going to have to find the protamine for the doctor, find the syringe, probably even draw it up for him or her, and give it to him. You're also going to be the one taking care of the patient after the protamine is administered. The most common adverse reactions, this drug causes a certain amount of vasodilation, so you're going to see a drop in heart rate, you're going to see a blood pressure drop. The person's going to feel very flushed and warm, and if they're awake, you can tell them that that's a normal side effect and that we'll be watching their vital signs. They also might complain of some dyspnea, and they're going to be very tired. So you're going to be watching them to make sure that they don't have drastic bradycardia, don't have a sudden drop in blood pressure that can result in a problem. You'll be keeping a pretty close eye on them after. Protamine sulfate is pretty safely given, but it doesn't interact well with some antibiotics such as penicillin or the cephalosporins like Keflex. So if a person has received IV antibiotics, the protamine can also neutralize those so that they don't get the good antibiotic result that they're expecting post-procedure. I'm going to stop right here because we're going to leave the area of anticoagulants and anticoagulant antidotes, and we're going to get into another whole type of drug, the thrombolytic. So I've got this little cartoon here, Who You Gonna Call? Clot Busters. And this is, I think, a really good cartoon showing what you can expect from a thrombolytic. Unlike an anticoagulant, which does not break up blood clots, a thrombolytic, or a fibrinolytic, as you might see it called, is given in the event of a blood clot, and it will stop them and dissolve them. So what this person in the cartoon is saying, he's calling this the Heart and Vascular Plumbing Department. It says our clot busters work. If you've got a clogged artery, just run these IV and watch them increase perfusion, decrease viscosity, and that's a word you need to be aware of. Viscous. Viscous means thick and tenacious as opposed to vicious, and sometimes I will see nurses use viscous and vicious interchangeably. They do not mean the same, although certainly a blood clot can be vicious. So know that term, viscosity. And it also decreases the aggregation, which we know means clumping of red blood cells. You want to administer via an infusion pump immediately after the particular event, and those events we'll be talking about. These drugs used might be streptokinase or Activase, which goes by TPA, used for MI, ischemic stroke, and PE. Also can open AV cannulas that are used for procedures like hemodialysis. When you're giving thrombolytics, you want to watch for allergic reactions, you want to watch for spontaneous bleeding, and oozing from any fresh wound site. A lot of times people who have come in with these conditions have had a lot of IV sticks and a lot of injections, and so once the clot is dissolved, the person's going to stay anticoagulated for a certain amount of time because the thrombin and the fibrin has been broken down, and so they might ooze from some of these wound sites. So you can just take a look at this cartoon, and then when I come back in my next video, when I come back in my next video, we will be talking about these particular thrombolytic drugs.